Okay, good.
Mr. Speaker,
Thank you.
as we approach Veterans Day, our nation is still faced with the epidemic of veteran suicides. And while the VA has made it a priority to address this problem, there are still many combat veterans left without access to VA mental health care services. Here is what we know. An average of 20 veterans commit suicide daily. VA evidence suggests a decrease in suicide risk among those who have received VA healthcare services. And in May 2017, the Government Accountability Office found that 62% of the over 91,000 service members who were separated from misconduct from 2011 to 2015 had been diagnosed with PTSD, TBI, or other conditions that would be associated with misconduct. Of those veterans, 23%, or 13,282, received an other than honorable discharge, leaving them without access to VA's critical mental health care services. As a Marine Corps combat veteran, I'd like to live by the rule that we never leave anyone behind. Unfortunately, the military routinely used the other than honorable discharge to rid itself of combat veterans who were designated as having disciplinary problems and who often had documented medical histories of PTSD, rather than providing them with the treatment and rehabilitation they so desperately needed. While the correlation between their mental health condition and minor misconduct could be linked, this fact made no difference to their character of discharge. Mr. Speaker, my legislation, H.R. 918, the Veteran Urgent Access to Mental Health Care Act, seeks to correct this. Historically, a veteran with an other than honorable discharge has been able to seek VA care for a service-connected disability. However, due to the way these combat veterans were discharged and because of a failure to connect the dots between their minor misconduct and their mental health condition, the Department of Defense has failed to recognize this as a problem. H.R. 918 will stay with tradition and correct this disconnect by authorizing mental health care services for these other than honorably discharged combat veterans. This bill also requires an initial mental health assessment and directs the VA Secretary to establish a formal character of service determination process to trigger reviews of their discharges for potential eligibility for VA benefits. Mr. Speaker, before the rate of veteran suicides increases anymore, it is time to right this wrong and permanently authorize mental health care services for some of our nation's most vulnerable veterans. When someone puts on the uniform, they take an oath to defend our freedoms. We, in turn, as a nation, promise to make sure they receive the care and the services they need after returning from the battlefield. As we approach Veterans Day, I encourage my colleagues to keep that promise for these combat veterans with other than honorable discharges and to support the passage of H.R. 918. Thank you, Mr. Chairman. Thank you, Chairman Rowe and Ranking Member Walsh, for your support of this legislation. Mr. Speaker, I yield back the balance of my time.